Imagine this: you've successfully potty trained your child, and everything seems fine. Then suddenly, they start wetting the bed again. At first, you think it's just an accident, maybe a bad dream or too much water before bed. But then, it keeps happening. Night after night. No matter what you try, the bedwetting doesn't stop. Or maybe you notice something else. Your child's mood is all over the place. One moment, they're happy and laughing, and the next, they're throwing tantrums over the smallest things. At first, you blame it on being tired, maybe hunger. But the mood swings seem more intense than usual, and no amount of snacks or naps seem to fix it. And then, something even stranger, your child is constantly hungry. They eat full meals, sometimes even more than usual, but somehow, they keep losing weight. Clothes start looking looser, their little arms and legs seem thinner, but they're still eating all the time. It doesn't make sense. Then, one day, they come to you and say, "Mom, I can't see the board at school," or "Dad, the words in my book look blurry." You schedule an eye test, thinking maybe they just need glasses. But what if it's something much bigger? These aren't just random childhood issues. They are actually early warning signs of diabetes, and most parents miss them completely. Unlike adults, children experience diabetes differently. Their bodies react in ways that aren't always obvious, and because they can't always explain what they feel, these symptoms often go unnoticed until the condition becomes serious. That's why in today's video, we're revealing 10 diabetes symptoms only kids experience, so you can catch them early and protect your child's health before it's too late. Some of these might surprise you. Welcome to Health Hub, where we bring you the latest science-backed health insights in the simplest way possible. If you want to stay informed and keep your loved ones healthy, make sure to subscribe so you never miss a crucial update. Now, let's get started with the first symptom. 1. Bedwetting returns, even after being trained. Imagine this: you've been through the potty training phase and for months, maybe even years, your child has been completely dry at night. Then, out of nowhere, they start wetting the bed again. At first, you might think it's a one-time accident, maybe they drank too much water before bed. But then it happens again. And again. Something isn't right. What most parents don't realize is that frequent urination is a major sign of diabetes, even in children. When blood sugar levels get too high, the body tries to flush out the excess glucose through urine. Since a child's bladder is smaller and their bodies process fluids differently than adults, this can lead to more accidents, especially at night. But it's not just about bedwetting. You might also notice your child needing to use the bathroom much more often during the day. Maybe they can't sit through an entire cartoon without running to the toilet. Or they wake up multiple times at night needing to pee. These are all red flags that something deeper is going on. Now, here's where it gets serious: dehydration. The more they urinate, the more fluids they lose. You might notice them drinking a lot more water than usual, yet they still seem thirsty all the time. Their lips may become dry, their skin may feel rough, and if the dehydration gets severe, it can lead to extreme fatigue and even fainting. Many parents assume bedwetting is just part of growing up or a phase kids will outgrow. But if it comes back suddenly after your child was already trained, it's time to pay attention. 2. Unexplained mood swings and irritability. Every child has their moments. Tantrums, whining, and crankiness are all part of growing up. But what if the mood swings seem too extreme? One minute, your child is playing happily, and the next, they're frustrated, crying, or even lashing out for no reason. This is not just normal childhood behavior. It could be a hidden sign of diabetes. When blood sugar levels fluctuate, it can cause sudden emotional changes. Low blood sugar, also known as hypoglycemia, can make kids feel tired, shaky, and irritable. Their brain isn't getting enough glucose, which can cause confusion, frustration, or even aggressive behavior. On the flip side, if their blood sugar is too high, it can make them feel sluggish, overwhelmed, and unable to concentrate. This can lead to meltdowns, difficulty focusing in school, or even behavioral problems that teachers might misinterpret as attention issues. Parents often think their child is just acting out or having a bad day. But if you notice frequent, unexplained mood swings that seem more intense than usual, and especially if they happen alongside other symptoms, it's worth taking a closer look. 3. Constant hunger, but still losing weight. Picture this: your child is eating all the time. They finish their breakfast, and an hour later, they're asking for a snack. Then lunch comes, and they're still ravenous. It seems like no matter how much food they eat, they're never satisfied. This isn't just a growth spurt. It's a sign that something is wrong. When a child has diabetes, their body isn't able to use sugar for energy properly. Normally, insulin helps move glucose from food into the cells to be used as fuel. But with diabetes, either the body doesn't produce insulin, or it can't use it effectively. This means the body can't get energy from food, so it sends hunger signals to the brain, leading to constant eating. But here's the shocking part: even though they're eating more, they're actually losing weight. When the body can't use glucose, it starts breaking down fat and muscle instead. This leads to unexplained weight loss, weaker muscles, and even fatigue. If your child is always hungry but seems thinner, weaker, or more tired than usual, it's time to take action. 4. Vision problems. Blurry sight at a young age. When we think of diabetes, we usually associate vision problems with adults, not children. But here's the truth: diabetes can affect eyesight at any age, even in kids. If your child suddenly struggles to see the board at school, squints while reading, or complains that things look blurry, it might not just be time for glasses, it could be an early warning sign of diabetes. High blood sugar levels cause swelling in the eye's lens, which changes its shape and makes it harder to focus. This leads to blurry vision, difficulty seeing clearly, and even frequent headaches from straining their eyes too much. Most parents assume their child just needs an eye checkup, but if blurry vision appears suddenly and alongside other symptoms, it's a sign that something bigger might be happening. And here's something most people don't know: diabetes-related vision issues can sometimes improve if blood sugar levels are controlled. But if left unchecked, it can lead to permanent eye damage. So if your child suddenly struggles with their eyesight, it's important to get it checked out right away. 5. Frequent stomach pain and nausea. Every child gets a stomachache now and then, whether it's from something they ate or just a regular upset tummy. But what if your child keeps complaining about stomach pain, even when there's no clear reason? What if they feel nauseous often, even when they haven't eaten anything unusual? This is where things get concerning. Most parents don't realize that frequent stomach pain and nausea can be early warning signs of diabetes. When blood sugar levels get too high, it can cause serious digestive issues. The body struggles to process food properly, leading to discomfort, nausea, and even vomiting in some cases. But there's another problem, a condition called diabetic ketoacidosis, or DKA. This happens when the body doesn't have enough insulin, so it starts breaking down fat for energy. This process releases toxic acids called ketones into the bloodstream, which can make your child feel extremely sick. A common symptom: severe stomach pain and nausea. If this isn't treated quickly, it can become life-threatening. That's why it's crucial to pay attention. If your child experiences constant stomach pain, frequent nausea, or even throws up without a clear cause, it's time to take a closer look. This isn't just a stomach bug, it could be something much more serious. 6. Cuts and bruises that take forever to heal. Kids are always on the move, running, jumping, playing. It's completely normal for them to get scrapes, cuts, and bruises along the way. But what's not normal? When those small injuries take way too long to heal. If your child has a simple cut that lingers for weeks, or a bruise that just won't fade, this could be a hidden sign of diabetes. High blood sugar levels can damage blood vessels, which slows down the body's ability to heal wounds. And here's something most parents never realize: slow healing cuts can lead to infections, especially in kids with diabetes. When blood sugar is too high, bacteria thrive, making it harder for the body to fight off even minor infections. A small scratch can quickly turn into a more serious issue. But it's not just about cuts and bruises. Even bug bites can take longer to go away. If you notice your child's scrapes, scratches, or mosquito bites staying inflamed for an unusually long time, it could be a red flag. 7. Yeast infections, even in young girls now. This is one symptom many parents don't expect, but it's more common than you think. Yeast infections in young children, especially girls, can be an early sign of diabetes. Here's why: yeast thrives on sugar. When blood sugar levels are too high, it creates the perfect environment for yeast to grow, especially in warm, moist areas of the body. This leads to recurring infections, even in kids who aren't old enough to understand what's happening. For young girls, this can mean redness, itching, discomfort, and even unusual discharge. Many parents assume it's just a simple rash or irritation, but if it keeps coming back, there's usually an underlying issue. And it's not just girls, young boys can also get yeast infections, especially in diaper areas. If your child complains of itching, burning, or discomfort in these areas, and the problem doesn't go away with regular treatments, high blood sugar might be to blame. If you've noticed your child struggling with repeated yeast infections or unusual rashes in private areas, it's a sign to dig deeper. This isn't just a simple skin issue, it could be something much bigger. 8. Skin darkening, especially around the neck. This is one of the most overlooked signs of diabetes in kids, a strange darkening of the skin, especially around the neck. Parents often assume it's dirt that won't wash off, but in reality, it's something called acanthosis nigricans, a condition linked to insulin resistance. When the body starts struggling with insulin, it reacts by producing excess skin cells in certain areas. This creates patches of dark, velvety skin, usually around the neck, armpits, or even the elbows and knees. At first, it might look like a shadow or a stain that just won't go away. Parents try scrubbing it off, but no matter how much soap they use, it stays the same. That's because this isn't dirt, it's a physical sign that your child's body isn't handling insulin properly. And here's the real danger: this symptom often appears years before diabetes is officially diagnosed. It's one of the earliest warning signs that the body is struggling to regulate blood sugar. If caught early, lifestyle changes and medical intervention can help prevent diabetes from progressing. So, if you've ever noticed dark patches on your child's neck or other areas, don't ignore it. This could be the body's way of warning you before things get worse. That brings us to 8 symptoms so far, but there are still 2 more surprising signs that many parents miss. And trust me, these last 2 are especially critical, because they can affect your child's long-term health in ways you never expected. So don't go anywhere, because the next one is something you'd never think to connect to diabetes. 9. Unusual fatigue. Even after resting, kids are naturally full of energy. They wake up ready to play, explore, and move around all day. But what if your child seems constantly exhausted, even after a full night's sleep? What if they're suddenly too tired to play, too drained to focus, or even struggling to stay awake during school? This is where diabetes can be silently draining their energy. When blood sugar levels are out of control, the body can't properly convert food into fuel. Instead of getting energy from glucose, their cells are left starving, even if they're eating normally. The result? Extreme tiredness that just won't go away. And this isn't just feeling a little sleepy, this is a deep, unusual fatigue that starts affecting their daily life. They might struggle to get out of bed in the morning, lose interest in activities they used to love, or even seem weak and sluggish throughout the day. But there's something even more concerning. If diabetes goes untreated, this fatigue can get much worse. In severe cases, it can even progress to diabetic ketoacidosis, DKA, where the body starts breaking down fat at a dangerous rate. This leads to dehydration, confusion, and extreme exhaustion, which can quickly become a medical emergency. If your child is suddenly too tired to do the things they used to enjoy, constantly feeling worn out, or even falling asleep at unusual times, this isn't just normal tiredness. It's a red flag that something deeper is going on. 10. Fruity smelling breath, a dangerous warning sign now. This is one symptom that many parents never connect to diabetes. But if you ever notice that your child's breath smells unusually sweet, fruity, or even like nail polish remover, this could be a sign of something very serious. Here's what's happening inside their body. When diabetes is out of control, and the body can't use glucose for energy, it starts breaking down fat instead. This process releases ketones, toxic acids that build up in the blood. And when these ketones get too high, they create a distinct, sweet-smelling breath. This isn't just a mild symptom, it's a warning sign of diabetic ketoacidosis, DKA, a life-threatening condition that requires immediate medical attention. Kids experiencing DKA may also have dry mouth, extreme thirst, rapid breathing, or even confusion. If left untreated, this can quickly lead to coma or worse. Many parents mistake this fruity breath for a normal variation in body odor or even assume their child just ate something sugary. But if this smell persists, especially alongside other symptoms like excessive thirst, fatigue, or nausea, this could be an urgent medical situation. If you ever notice this sweet, unusual breath odor, don't ignore it. It's a strong sign that your child's body is in distress and needs immediate medical attention. Conclusion: so there you have it, 10 diabetes symptoms that only kids experience. Some of these signs might seem small on their own, but when you put them together, they tell a much bigger story. The key to protecting your child's health is spotting these symptoms early, before things get worse. Now, if you've noticed one or more of these signs in your child, don't panic, but don't ignore them either. Diabetes in kids is more common than most people realize, and early detection can make all the difference. A simple blood test can confirm whether blood sugar levels are too high, and from there, doctors can help create a plan to manage it. And remember, not all kids show symptoms in the same way. Some may have just one or two of these warning signs, while others might experience several at once. That's why it's so important to stay informed, pay attention, and trust your instincts as a parent. If you found this video helpful, make sure to subscribe to Health Hub for more important health tips. And if you know someone with a child who might be at risk, share this video with them. It could help them catch the warning signs before it's too late. Thanks for watching, and stay healthy.